during the evaluation, it became clear to me that Sarah has semantic variant primary progressive aphasia. So, neuroimaging studies completed about a year after the day that she became lost demonstrated a loss of brain volume and neural activity in the left temporal lobe, and that's the side of the brain that most frequently manages language function. Okay? And her husband understood this and understood that this condition is progressive. So, primary progressive aphasia is a disorder of language in which the person demonstrates a progressive deterioration of understanding words, especially nouns, recognizing objects, while other cognitive faculties often remain remarkably spared. Sarah retained the ability to produce fluent speech, but without being able to generate the key words within the sentences, the speech became increasingly difficult to understand. Sarah was also losing the ability to recognize the meaning of specific words or to spontaneously name familiar objects. So as the frontotemporal lobe degeneration progresses, people lose not only the ability to name things, but also the conceptual knowledge for the words that they're trying to name.
Sam's short-term goals were also designed with a homegoing discharge plan in mind. The items of key importance for him were following a daily schedule, benefiting from the routine, engaging in conversation with family and friends and other caregivers, reading the Bible, and he needed tasks that would prepare him for performing medication management, thus the targets of similarities and differences. So his short-term goals included: Sam will engage in conversation with familiar listeners across 6 exchanges without cues to maintain topic. Sam will create a daily schedule, adding 4 items to it from a choice of 8. Sam will complete pleasure reading activities for 10 minutes daily. And finally, Sam will describe similarities and differences with 80% accuracy.
So here are some of the interventions that we use. So I wanted to support her love for reading and doing puzzles, but the environment didn't support this at all. So in order to support her preserved abilities, I increased the lighting in her room. I asked the care community to provide task lighting next to the chair in her room and to the bed, and to change the bulbs in the current light fixtures to fluorescent bulbs. This really cut down on the glare, and we increased them to the highest wattage that the fixture would allow. So this increased light and it decreased the glare. I also rearranged the chair so it was next to some natural lighting, and then I asked the care community to provide a sheer on the window to help us minimize glare but still let natural light in.
So one of the problems that Mary is exhibiting currently in the beginning of her medical situation here is that she has been calling out buddy, buddy to the nurses with quite a bit of frequency. And if the nurses hear her calling for buddy and they come in and ask her about it, they may or may not get a response that's meaningful or something understandable. So I'm going to need to be able to explain that to the nurses and engage them in the whole process of this intervention approach. One of the things that's going to be important about it is that the nurses are going to need to keep track of how often she calls out and to keep track of how effective the message board is when they direct her to read it and to interact with them about the messages that are on the board. So I go through a process of having Mary read 4 sentences, and it's quite clear that 4 is too much. She is having difficulty focusing on each sentence individually. The size of the print needs to be a little bit bigger so that she can read it easily. And this makes me also think that maybe I need to ask her daughter whether or not she wears glasses, because she is having difficulty seeing the sentence. It's not going to be effective in the long term.
Remember that a person with dementia may refuse to eat food or may spit it out. This may be because they dislike the food, are trying to communicate something, such as the food being too hot, or they're unsure of what to do with the food. The person with dementia may become angry or agitated or exhibit challenging behavior during mealtimes. This can be for a variety of reasons, such as frustration at any difficulties they are having, feeling rushed, the environment they are in, the people that they are with, or not liking the food. They may not want to accept assistance with eating. It can be a challenge to identify what the problem is, particularly if the person is struggling to find the words to explain it. It is important to remember that these reactions are not a deliberate attempt to be difficult or a personal attack.